HESI Nursing Competence Test. Question 1. A client with tuberculosis, TB, is taking isoniazid, INH. Which instruction is most important for the nurse to include? Take the medication with food to avoid stomach upset. Avoid exposure to sunlight while taking this medication. Report any numbness or tingling in extremities. Have liver function tests done regularly. D. Have liver function tests done regularly. Correct answer, Step 1, isoniazid, INH, can cause liver toxicity. Step 2, regular liver function tests help monitor for liver damage. Step 3, monitoring liver function is crucial to prevent serious complications. Step 4, other choices are not directly related to INH's side effects. Summary, choice D is correct as it directly addresses a potential serious side effect of INH. Choices A, B, and C are not directly relevant to the medication's side effects. Question 2. A client with a spinal cord injury at T6 suddenly reports a pounding headache and blurred vision. What action should the nurse take first? Administer pain medication as ordered. Check the client's blood pressure. Place the client in a supine position. Increase the client's fluid intake. B. Check the client's blood pressure. Correct answer, the correct action is to check the client's blood pressure first. A sudden onset of pounding headache and blurred vision in a client with a spinal cord injury at T6 can indicate autonomic dysreflexia. Checking the blood pressure is crucial as autonomic dysreflexia can lead to severe hypertension, which can result in life-threatening complications such as stroke or seizure. Immediate assessment and intervention are necessary to prevent further harm. Administering pain medication without addressing the underlying cause can exacerbate hypertension. Placing the client in a supine position can worsen symptoms, and increasing fluid intake does not address the immediate issue at hand. Therefore, checking the blood pressure is the priority to identify and manage autonomic dysreflexia effectively. Question 3. A nurse cares for a client with chronic obstructive pulmonary disease who has been prescribed continuous oxygen therapy at home. Which statement indicates the client correctly understands the teaching? I plan to wear my oxygen when I exercise and feel short of breath. I will use my portable oxygen when grilling burgers in the backyard. I plan to use cotton balls to cushion the oxygen tubing on my ears. I will only smoke while I am wearing my oxygen via nasal cannula. C. I plan to use cotton balls to cushion the oxygen tubing on my ears. Correct answer, the correct answer is C because using cotton balls to cushion the oxygen tubing on the ears helps prevent skin irritation or pressure ulcers. This indicates the client understands the importance of skincare and comfort while using oxygen therapy. A. Incorrect. The client should wear oxygen during all activities that increase oxygen demand, not just when feeling short of breath during exercise. B. Incorrect. Using portable oxygen near an open flame like a grill can result in a fire hazard. D. Incorrect. Smoking while using oxygen therapy is extremely dangerous and can lead to a fire. Question 4. A client tests positive for alpha-1 antitrypsin, AAT, deficiency and asks the nurse, what does this mean? How should the nurse respond? Your children may be at high risk for developing chronic obstructive pulmonary disease. I will arrange for a genetic counselor to discuss your condition. Your risk for chronic obstructive pulmonary disease is higher, particularly if you smoke. This is a recessive gene that should not affect your health. C. Your risk for chronic obstructive pulmonary disease is higher, particularly if you smoke. Correct answer, rationale, C is correct because AAT deficiency increases the risk of COPD, especially with smoking. This response provides accurate information regarding the client's health risk. A is incorrect as it specifically mentions children rather than the client's own risk. B is incorrect as it focuses on genetic counseling rather than addressing the client's question. D is incorrect as it inaccurately states that the gene does not affect health. Question 5. A client with end-stage heart failure who is. How should the nurse respond? Would you like information about advance directives? I will arrange for a psychiatrist to speak with you. Do you want to come off the transplant list? Would you like to speak with a priest or chaplain? A. Would you like information about advance directives? Correct answer. The correct answer is A. Would you like information about advance directives? This is the appropriate response as it addresses the client's concerns about becoming a vegetable and explores their wishes for end-of-life care. Advance directives can help the client make decisions about their care in case they are unable to communicate in the future. The other choices are incorrect because B assumes the client needs psychiatric evaluation, C suggests removing them from the transplant list without exploring their concerns further, and D focuses on spiritual support rather than addressing the client's specific worries about their quality of life post-transplant. Question 6. A client with heart failure expresses feelings of burden and thoughts of death to a nurse. How should the nurse respond? Would you like to talk more about this? You are lucky to have such a devoted daughter. It is normal to feel as though you are a burden. Would you like to meet with the chaplain? A. Would you like to talk more about this? Correct answer. The correct answer is A because it demonstrates active listening and empathy, encouraging the client to express their feelings further. This response shows support and openness to discuss sensitive topics, promoting therapeutic communication. Choice B fails to address the client's emotional distress directly. Choice C may invalidate the client's feelings. Choice D may not be appropriate unless the client expresses interest in meeting with the chaplain. Overall, option A is the best response for addressing the client's emotional needs effectively. Question 7. The client with a chest tube after a coronary artery bypass graft has significantly slowed drainage. What action is most important for the nurse to take? Increase the setting on the suction. Notify the provider immediately. Reposition the chest tube. Take the tubing apart to assess for clots. B. Notify the provider immediately. Correct answer. The correct answer is B. Notify the provider immediately. This is the most important action because significantly slowed drainage in a client with a chest tube after surgery can indicate a potential complication like a blocked tube or bleeding. Notifying the provider allows for prompt assessment and intervention to prevent further complications. Increasing the suction setting, choice A, without knowing the reason for slowed drainage can potentially worsen the situation. Repositioning the chest tube, choice C, may not address the underlying issue causing the slowed drainage. Taking the tubing apart to assess for clots, choice D, should not be done by the nurse as it can introduce the risk of infection and requires sterile technique. Question 8. A client presents to the emergency department with an acute myocardial infarction, MI, at 1500, 3 p.m. The facility has 24-hour catheterization laboratory capabilities. To meet the Joint Commission's core measures set, by what time should the client have a percutaneous coronary intervention performed? 1530, 3:30 p.m. 1600, 4 p.m. 1630, 4:30 p.m. 1700, 5 p.m. C. 1630, 4:30 p.m. Correct answer. The correct answer is C. 1630, 4:30 p.m. The rationale is as follows. 1. The standard guideline for performing percutaneous coronary intervention, PCI, in acute MI is within 90 minutes of arrival at the hospital. 2. The client arrived at 1503 p.m., so adding 90 minutes to this time gives us 1630, 4:30 p.m. 3. This timing aligns with the Joint Commission's core measures for timely PCI in acute MI cases. 4. Therefore, the correct time for the client to have PCI performed is 1630, 4:30 p.m. In summary, choices A, B, and D are incorrect because they do not align with the 90-minute guideline for performing PCI in acute MI cases, as mandated by the Joint Commission's core measures. Question 9. A healthcare provider is assessing a client who had a myocardial infarction. Upon auscultating heart sounds, the provider hears the following sound. What action by the provider is most appropriate? Assess the client's lung sounds. Call the rapid response team. Have the client sit upright. Listen to the client's lung sounds. A. Assess the client's lung sounds. Correct answer. The correct answer is A. Assess the client's lung sounds. This is important because after a myocardial infarction, there is a risk of pulmonary edema, which can present as crackles or wheezes in the lungs. By assessing the lung sounds, the healthcare provider can identify any signs of respiratory distress and promptly intervene if necessary. Choice B is incorrect because calling the rapid response team is not warranted based solely on abnormal heart sounds. Choice C is incorrect as having the client sit upright is not directly related to addressing abnormal heart sounds. Choice D is also incorrect as it focuses solely on assessing lung sounds without considering the potential implications of the abnormal heart sounds. Question 10. A nursing student learns about modifiable risk factors for coronary artery disease. Which factors does this include? SADA, age, hypertension, obesity, smoking. B. Hypertension. Correct answer. Step-by-step rationale. 1. Hypertension is a modifiable risk factor as it can be controlled through lifestyle changes and medication. 2. Age is a non-modifiable risk factor, as it naturally increases the risk of coronary artery disease. 3. Obesity is a modifiable risk factor, as weight management through diet and exercise can reduce the risk. 4. Smoking is a modifiable risk factor, as quitting smoking can significantly reduce the risk. Summary: B is correct as it is a modifiable risk factor that can be actively managed. A, C, and D are incorrect as age is non-modifiable and obesity and smoking are modifiable but were not selected as correct options. Question 11. How does the pain of a myocardial infarction, MI, differ from stable angina? Accompanied by shortness of breath. Feelings of fear or anxiety. Lasts less than 15 minutes. No relief from taking nitroglycerin. C. Lasts less than 15 minutes. Correct answer. The correct answer is C because the pain of a myocardial infarction, MI, typically lasts longer than 15 minutes, unlike stable angina which lasts for a shorter duration. MI pain is usually described as intense, crushing, and prolonged, whereas stable angina pain is often triggered by exertion and relieved by rest or medication like nitroglycerin. Choices A, B, and D are incorrect because shortness of breath, feelings of fear or anxiety, and lack of relief from nitroglycerin are not definitive differentiating factors between MI and stable angina. Question 12. A client has a pulmonary embolism and is started on oxygen. The student nurse asks why the client's oxygen saturation has not significantly improved. What response by the nurse is best? Breathing so rapidly interferes with oxygenation. Maybe the client has respiratory distress syndrome. The blood clot interferes with perfusion in the lungs. The client needs immediate intubation and mechanical ventilation. C. the blood clot interferes with perfusion in the lungs. Correct answer, C. Rationale. 1. A pulmonary embolism is a blockage in one of the pulmonary arteries, affecting blood flow to the lungs. 2. This blockage limits perfusion, the process of blood flow through the lungs for oxygenation. 3. Oxygen saturation may not improve significantly because the blood clot interferes with perfusion, not ventilation. 4. Options A and B focus on ventilation issues, which may not be the primary concern in this case. 5. Option D is extreme and not supported by the information given about the client's condition. Summary: choice C is correct because a pulmonary embolism affects perfusion in the lungs, leading to decreased oxygen saturation. Choices A, B, and D are incorrect as they focus on other issues not directly related to the client's condition. Question 13. A client is hospitalized with a second episode of pulmonary embolism, PE. Recent genetic testing reveals the client has an alteration in the gene CYP2C19. What action by the nurse is best? Instruct the client to eliminate all vitamin K from the diet. Prepare preoperative teaching for an inferior vena cava, IVC, filter. Refer the client to a chronic illness support group. Teach the client to use a soft bristled toothbrush. B. Prepare preoperative teaching for an inferior vena cava, IVC, filter. Correct answer. The correct answer is B. Prepare preoperative teaching for an inferior vena cava, IVC, filter. In the context of a client with an alteration in the gene CYP2C19 and recurrent pulmonary embolism, the use of an IVC filter helps prevent blood clots from traveling to the lungs. This intervention is crucial in managing the risk of further pulmonary embolism. Teaching the client about the purpose, care, and potential complications of the IVC filter is essential for their understanding and cooperation in the treatment plan. Incorrect choices: A. Instruct the client to eliminate all vitamin K from the diet. This choice is not relevant to the management of recurrent pulmonary embolism associated with a genetic alteration. C. Refer the client to a chronic illness support group. While support is important, it is not the immediate priority in this case of managing a recurrent PE. D. Teach the client to use a soft bristled toothbrush. This recommendation is not directly. Question 14. A client with newly diagnosed osteoporosis is being taught about lifestyle modifications. Which instruction should be included? Increase intake of caffeinated beverages. Engage in weight-bearing exercises regularly. Avoid exposure to sunlight. Take calcium supplements with iron. B. Engage in weight-bearing exercises regularly. Correct answer: Step 1. Weight-bearing exercises help improve bone density and strength, crucial in managing osteoporosis. Step 2. Regular engagement in weight-bearing exercises can reduce the risk of fractures in individuals with osteoporosis. Step 3. Increasing intake of caffeinated beverages can contribute to bone loss. Step 4. Avoiding exposure to sunlight can decrease vitamin D levels necessary for calcium absorption. Step 5. Taking calcium supplements with iron may interfere with calcium absorption. Summary: choice B is correct as weight-bearing exercises are essential for managing osteoporosis. Choices A, C, and D are incorrect because they can have negative impacts on bone health. Question 15. A healthcare professional is assessing a client with left-sided heart failure. Which finding is most commonly associated with this condition? Peripheral edema, jugular vein distension, hepatomegaly, crackles in the lungs. D. Crackles in the lungs. Correct answer: the correct answer is D. Crackles in the lungs. Left-sided heart failure leads to fluid accumulation in the lungs, causing crackles on auscultation. This indicates pulmonary congestion. Peripheral edema: A. is more common in right-sided heart failure. Jugular vein distension, B, is typically seen in right-sided heart failure due to increased venous pressure. Hepatomegaly, C, is more common in conditions like liver disease, not specifically left-sided heart failure. Question 16. A client has a pleural chest tube. Which action should the nurse take to ensure safe use of this equipment? Never strip the tubing to maintain patency. Secure tubing junctions with tape to prevent accidental disconnect ions. Set wall suction at the level recommended by the device manufacturer. Keep padded clamps at the bedside for use if the drainage system is interrupted. D. Keep padded clamps at the bedside for use if the drainage system is interrupted. Correct answer. The correct answer is D. Keep padded clamps at the bedside for use if the drainage system is interrupted. This is essential because if the drainage system is interrupted, the nurse needs to immediately clamp the tube to prevent air from entering the pleural space. Clamping the tube can prevent a potentially life-threatening situation. A. Never strip the tubing to maintain patency. Stripping the tubing can lead to increased negative pressure, which can be harmful. B. Secure tubing junctions with tape to prevent accidental disconnect ions. While securing tubing is important, clamping the tube in case of interruption is more critical. C. Set wall suction at the level recommended by the device manufacturer. This is important for proper functioning but not as crucial as having clamps ready for emergencies. Question 17. A nurse cares for a female client who has a family history of cystic fibrosis. The client asks, "Will my children have cystic fibrosis?" How should the nurse respond? Since many of your family members are carriers, your children will also be carriers of the gene. Cystic fibrosis is an autosomal recessive disorder. If you are a carrier, your children will have the disorder. Since you have a family history of cystic fibrosis, I would encourage you and your partner to be tested. Cystic fibrosis is caused by a protein that controls the movement of chloride. Adjusting your diet will decrease the spread of this disorder. C. Since you have a family history of cystic fibrosis, I would encourage you and your partner to be tested. Correct answer. Rationale. C is correct because it encourages genetic testing for both the client and their partner to assess the risk of passing on the cystic fibrosis gene. This approach provides the necessary information for informed decision-making regarding family planning. A is incorrect because being a carrier does not guarantee that the children will also be carriers. B is incorrect as it inaccurately states that if the client is a carrier, their children will have the disorder. D is incorrect because it oversimplifies the etiology of cystic fibrosis and suggests dietary adjustments as a solution, which is not effective in managing the genetic condition. Question 18. A nurse assesses a client who has a history of heart failure. Which question should the nurse ask to assess the extent of the client's heart failure? Do you have trouble breathing or chest pain? Are you able to walk upstairs without fatigue? Do you awake with breathlessness during the night? Do you have new onset heaviness in your legs? B. Are you able to walk upstairs without fatigue? Correct answer. The correct answer is B because assessing the client's ability to walk upstairs without fatigue helps determine the extent of heart failure. This question assesses the client's functional capacity and exercise tolerance, which are key indicators of heart failure severity. If the client experiences fatigue while walking upstairs, it indicates decreased cardiac output and potential heart failure progression. Other choices are incorrect as they focus on symptoms: A. Nocturnal dyspnea, C. And peripheral edema, D. Which may be present in heart failure but do not directly assess the extent of heart failure like exercise tolerance does. Question 19. A client who is intubated and has an intra-aortic balloon pump is restless and agitated. What action should the nurse perform first for comfort? Allow family members to remain at the bedside. Ask the family if the client would like a fan in the room. Keep the television tuned to the client's favorite channel. Speak loudly to the client in case of hearing problems. A. Allow family members to remain at the bedside. Correct answer. The correct answer is A. Allow family members to remain at the bedside. This is the priority action as it provides emotional support and comfort to the client. Having familiar faces around can help calm the client and reduce agitation. It also promotes a sense of security and connection. Choices B, C, and D are incorrect because they do not address the client's immediate need for comfort and emotional support. Asking about a fan, tuning the TV, or speaking loudly do not directly address the client's restlessness and agitation. Prioritizing the presence of family members is essential in this situation. Question 20. During a home visit to an older client living alone post-coronary artery bypass graft, what finding prompts the nurse to consider additional referrals? Dirty carpets requiring vacuuming. Expired food found in the refrigerator. Outdated medications stored in the kitchen. Presence of multiple cats in the home. B. Expired food found in the refrigerator. Correct answer. The correct answer is B. Expired food found in the refrigerator, because it poses a potential health risk to the client. Expired food can lead to foodborne illnesses, especially for an older adult post-surgery. Dirty carpets, choice A, may not directly impact the client's health. Outdated medications, choice C, can be addressed by the nurse without additional referrals. The presence of multiple cats, choice D, may be a concern for allergies or cleanliness, but it is not as urgent as expired food in terms of health risks. Question 21. The provider requests the nurse to start an infusion of an inotropic agent on a client. How should the nurse explain the action of these drugs to the client and spouse? It constricts vessels, improving blood flow. It dilates vessels, which lessens the work of the heart. It increases the force of the heart's contractions. It slows the heart rate down for better filling. C. It increases the force of the heart's contractions. Correct answer. The correct answer is C. It increases the force of the heart's contractions. Inotropic agents are medications that enhance the strength of the heart's contractions, improving cardiac output. This explanation is accurate because inotropic agents work by increasing the contractility of the heart muscle, leading to stronger contractions and improved pumping ability. Explanation for why the other choices are incorrect. A. It constricts vessels, improving blood flow. This is incorrect because inotropic agents primarily affect the heart's contractility, not vascular constriction. B. It dilates vessels, which lessens the work of the heart. This is incorrect because inotropic agents do not primarily dilate vessels, their main action is on the heart's contractility. D. It slows the heart rate down for better filling. This is incorrect because inotropic agents do not slow down the heart rate, they increase the force of contractions. In summary, choice C is correct as inotropic agents increase the force of. Question 22. A client had an inferior wall myocardial infarction, MI. The nurse notes the client's cardiac rhythm as shown below. What action by the nurse is most important? Assess the client's blood pressure and level of consciousness. Call the healthcare provider or the rapid response team. Obtain a permit for an emergency temporary pacemaker insertion. Prepare to administer antidysrhythmic medication. A. Assess the client's blood pressure and level of consciousness. Correct answer. The correct action is to assess the client's blood pressure and level of consciousness. This is crucial in a client with an inferior wall MI to monitor for potential complications like cardiogenic shock. Assessing these vital signs can provide immediate information on the client's hemodynamic stability. Calling the healthcare provider or rapid response team may be necessary based on assessment findings. obtaining a permit for a temporary pacemaker insertion and preparing to administer antidysrhythmic medication are not the most immediate priorities and may not address the client's current needs. Question 23. A student learns about modifiable risk factors for coronary artery disease. Which factors does this include? Select one that does not apply. Age, hypertension, obesity, smoking. A. Age. Correct answer. The correct answer is A. Age. Age is a non-modifiable risk factor for coronary artery disease, meaning it cannot be changed or controlled. Hypertension, obesity, and smoking are modifiable risk factors as they can be managed through lifestyle changes or medical interventions. By controlling blood pressure, maintaining a healthy weight, and quitting smoking, individuals can reduce their risk of developing coronary artery disease. Age, however, is a natural process that cannot be altered. Therefore, focusing on managing modifiable risk factors is crucial in preventing coronary artery disease. Question 24. A client is admitted with a pulmonary embolism, PE. The client is young, healthy, and active, and has no known risk factors for PE. What action by the nurse is most appropriate? Encourage the client to walk for 5 minutes each hour. Refer the client for smoking cessation classes. Teach the client about Factor V Leiden testing. Explain to the client that sometimes no cause for the disease is found. C. Teach the client about Factor V Leiden testing. Correct answer. The correct answer is C because teaching the client about Factor V Leiden testing is important in this scenario. Factor V Leiden is a genetic mutation that increases the risk of blood clot formation, including pulmonary embolism. Since the client has no known risk factors for PE, testing for this specific genetic mutation can help identify an underlying cause. Encouraging walking, choice A, is generally beneficial but may not address the root cause. Referring for smoking cessation, choice B, is not relevant in this case. Explaining that sometimes no cause is found, choice D, is not proactive and may lead to missed opportunities for prevention. Question 25. A client is on intravenous heparin to treat a pulmonary embolism. The client's most recent partial thromboplastin time, PTT, was 25 seconds. What action should the nurse anticipate? Decrease the heparin rate. Increase the heparin rate. No change to the heparin rate. Stop the heparin, start warfarin, Coumadin. B. Increase the heparin rate. Correct answer. The correct answer is B. Increase the heparin rate. A PTT of 25 seconds indicates that the client's blood is not adequately anticoagulated, as the therapeutic range for PTT is typically around 60 to 80 seconds for heparin therapy. Therefore, the nurse should anticipate increasing the heparin rate to achieve the desired anticoagulant effect and prevent further clot formation. Incorrect choices: A. Decreasing the heparin rate would further decrease the anticoagulant effect, potentially putting the client at risk for thrombus progression. C. No change to the heparin rate would not address the subtherapeutic PTT level and could lead to inadequate anticoagulation. D. Stopping heparin and starting warfarin is not appropriate at this time as warfarin takes time to reach therapeutic levels, whereas heparin provides immediate anticoagulation for acute situations like a pulmonary embolism.